hormone therapy for menopause is the talk of the town. Now that the FDA has removed the black box warning from a lot of transdermal topical estrogen treatments, including vaginal estrogen, women are much more interested. They realize finally it's safe, and whatever doctors like me have been preaching for a while, it's coming to the realization that estrogen is beneficial, and they want to use estrogen. There's actually pharmacies running out of patches. So most women prefer estrogen therapy that's covered by their insurance. Therefore, a lot of women are actually starting on estradiol patches. So what is the preferred dosing? Should you start low and then kind of go up gradually? Should you start with a dose that's a medium dose, because it's easier to go up a bit, down a bit if it's too much or too low, or start on the highest dose? If you're a young patient with a lot of symptoms, should you just start point blank on the highest dose? Well, that depends on the intensity of symptoms for each patient. It depends on your goals. If somebody presents with severe hot flashes, severe sleep disturbance, and severe fatigue and foggy brain due to poor sleep, you want to address those hot flashes the sooner the better. This is not someone you want to start on a very low dose. You don't want to ask for the lowest dose of patch because you're going to get 20% improvement, maybe 30. And then you jump up to the next dose up that's going to give you a little bit more, 10 to 15%. So you want to get the maximum improvement from the dose that you can, but that correlates with your symptomatology and your blood test results, because the blood test does tell you some information. Do you have estradiol? How much? Do you have FSH elevation, and how much and how elevated it is? And then progesterone combined with estrogen can also help with the symptomatology of the hot flashes in the night and the sleep. And should you start at 100 or at 200? I do prefer to start progesterone first and then add estrogen. But if a woman comes in with a lot of symptomatology, a lot of problems related to the estrogen loss, you want to start on estrogen as soon as possible, because it will relieve all her problems as soon as possible. So long story short, there's different approaches. Start low, go up gradually. If you're a sensitive patient that is very sensitive to treatments in general, to supplements, to vitamins, you know you react poorly to all kinds of treatments, then you would start at the lowest dose. And then you slowly, gradually go up. But if you're someone with intense symptomatology that is young and healthy, then probably a medium high to a high dose would be probably where you would start, and you'd get the maximum relief of your symptoms quickly. Yes, we can increase your dose gradually every 2 weeks, every 3 weeks. You'd have to come in and see the doctor and get a dose adjustment every time you need that. So as long as you have the time, the patience, and the desire, gradual dosing